you today?
Good, thanks.
My name's Autumn. I'm going to be your student nurse today. We're going to do a head-to-toe assessment. It should take about 15-20 minutes or so. Can you tell me your name and date of birth for me?
Yeah, Ariana Justice and 7/25/96.
Okay, do you have any allergies or anything I should know about?
Only to peanuts.
Okay, perfect. I'm going to go wash my hands and get stuff ready, and then I'll come back and we'll start the head-to-toe assessment, okay? Alright, patient posture is erect and upright. The patient is calm and relaxed. Can you tell me about your hygiene practices, like how often you bathe and wash your hair?
I bathe like once a day and I brush my teeth twice a day. That's pretty much it. I wash my hair probably every other day, but I bathe like.
Okay. Patient hygiene is appropriate for season and age. Can you rate your pain for me today?
A 0.
Okay. Patient has no lines, tubes, or drains noted at this time. Can you please tell me your full name?
Ariana Joelle Justice.
And do you know where you're at today?
Yes, at Cox North.
Okay, and do you know today's date?
Yeah, it is December 3rd, 2018.
Okay.
I know the date.
Patient is alert and oriented to time, place, and person. Can you please smile for me? Okay, thank you. Patient's face and smile is symmetrical, no drags, laggingness, or anything. And skin on the face is clear, no lesions, wounds, scars noted, the skin is intact. I'm going to just feel around on your head and your scalp, and I want you to let me know if you have any tenderness. Okay, any?
No.
Okay, patient's scalp is clear, clean, no lesions, wounds, or masses. Patient's hair is evenly distributed, brown, appropriate color matches the rest of the hair on her face. Face is head is appropriate size for body, proportional, midline, normocephalic. No masses noted. Patient's speech is intact, no slurs or stutters noted. So now I'm going to test your upper extremity strength. So I'm just going to do a couple things here. So I'm going to put my hands on your shoulders, and I want you to shrug up against my hands, okay? Okay, now I want you to lift your arms up like this for me, and whenever I pull this way, I want you to pull towards yourself, okay?
Okay.
Go. Okay, now I want you to push against my hands. Thank you. All right, patient's upper extremity is +5 strength. And then I want you to squeeze my fingers as well. Okay, patient hands are +5 strength as well. Now I'm going to test some sensory stuff on your upper extremities. So I have this cotton ball, and I'm going to place it on a spot on your face and on your arms, and I want you to point to where you think I'm touching at, okay? So go ahead and close your eyes. Okay, patient sensory is intact. Can say where location is whenever have sensory on base. Okay, now I'm going to do this test. So it's sharp versus dull. So I'm going to put, this is the dull side. So it's going to be a little bit soft, and then this side's going to be dull. So it's going to be a little bit sharper. So you're going to close your eyes. I'm going to place it on a spot, and then you're going to tell me if it's sharp or dull, okay?
Dull. Sharp. Dull. Sharp. Sharp. Dull. Dull. Sharp.
Okay, patient sensory is intact on upper extremities. The skin on the upper extremities is intact. There's no lesions, wounds, or masses noted, no scars. Patient's eyebrows are evenly distributed. They're symmetrical. They're appropriate size and shape. And the patient's lashes are evenly distributed. They're curved outward. They are appropriate color and hair is evenly distributed. The sclera on the patient's eyes is white. There's no redness or swelling or drainage on the eyes. Her cornea is clear, transparent. There's no lesions, drainage, or wounds. I want you to take your fingers and pull your eyelids down just a second for me so that way I can see. Okay, thank you. The conjunctiva is pink, it's moist, there's no drainage or lesions, wounds, bleeding, or swelling noted. I'm going to have you close your eyes just for a second for me. Okay, thank you. The patient's eyelids have no lag, they're symmetrical, there's no swelling or drainage noted there. Okay, now I'm going to test your pupils. Okay, so I'm going to put this pin light around your face, and I just want you to stare forward, and I'm just going to test a few things, okay? So just look straight forward for me. Okay, patient Perla is intact. Pupil size is approximately 3 millimeters bilaterally. The Perla is intact on bilaterally as well. Okay, so I'm going to take a look at your ears real quick. I'm going to just tuck your hair behind that way I can see. Okay, the ear structures are symmetrical. There's no swelling, wounds, no redness noted, no obstruction seen. They are appropriate size for rest of body. And do you have any tenderness on your ears if I kind of feel around here?
No.
Okay, no pain or tenderness noted with ears or reported. Do you have any hearing or vision issues?
No.
Okay. So I want you to hold this card about this far away from your face, and I want you to read this first line here for me, okay?
Okay.
Yeah.
A-F-A-F-D-C.
Okay, thank you. So the patient can read on the Rosenbaum vision test. She can read the bottom line correctly. So I'm just going to take a look at some of the structures on your face real quick and at your nose. So patient's nose is midline. There's no lesions, wounds. It's appropriate size for the body. There's no septum deviation noted. I'm just going to have you put one finger on one side, close off that side, and I want you to take a breath in through your nose. Okay, and then the other side. Okay, and I'm just going to take a look real quick. Okay, ears are patent bilaterally. There's no obstruction. Patient can breathe with no obstruction in ears. Okay, now I'm going to take a look at your oral hygiene inside of your mouth. So I'm just going to have you open your mouth, stick out your tongue, and say ah. All right, the oral mucosa is pink. It is moist. There's no wounds, bleeding, or lesions inside of the mouth. The tongue is midline, pink, moist. There's no lesions or wounds or bleeding. The teeth are white. There's no cavities or any type of decay noted. Can you tell me about your oral hygiene, like how often you brush your teeth and floss?
I brush like twice a day, but I don't floss that much, so maybe like once every few days.
Okay. Patient oral hygiene is appropriate for season and age. Okay, so I'm just going to test a couple things here. I'm going to test the cap refill on your hands. So I'm just going to press down on some of your fingertips and also on your toenails, and we're just going to see a few things here, okay? Cap refill is less than 3 seconds on upper and lower extremities. The cap refill is intact and oxygenation to those extremities are good. So now I'm just going to check some of your pulses. So I'm going to start out here with your radial pulses, so around your thumbs here. I'm just going to pull up your hair tie a little bit. No, you're fine. patient's radial pulses is +2 strength bilaterally. There's no bounding noted or abnormal rates. Okay, then I'm just going to check your brachial pulses. So I'm just going to kind of straighten your arms out here. Just a second. Okay, patient's brachial pulses are +2 bilaterally. Now I'm going to check your pedal pulses. Okay, so it's going to be on your feet here.